when he was kind of in decline, and had to wrap my brain around what is A, what is B, what's a supplemental, all of this. So for people approaching that, if you're 64, you may still not know. Medicare Part A, B, what's the difference?
Yeah, so think of A as your catastrophic for hospitalization, your hospital insurance, which covers those big expenses, hospital stays, semi-private rooms, things of that nature. And think of Medicare Part B as your everyday medical insurance. That's going to cover your doctor's visits and such. And that typically has a small deductible and usually about 80% coinsurance and 20% you would be responsible for. So that's how you really want to think of those two things. From a cost perspective, A is something that most people don't pay for. B, there is an expense associated with that, and that will depend upon your income.
Okay, if I looked confused, I'm a bit confused. So B, just get specific for us, because again, I think people who are in the industry get it. All of us, we don't necessarily get it. If you have some sort of carryover insurance from your former employer, or if you don't, like, does that take the part of B?
So it depends on who's primary and who's not primary, depending upon typically if you work for a large employer. So if your employer has 20 or more employees and you're still working, then the health coverage that you're receiving through the employer will be your primary. And then that will shift over once you're no longer working for that employer any longer. But if you're not working at that point, then Medicare Part B is your primary insurance.
Okay, and they are very specific, right, about when you file for your Medicare. There's this discrete window. And also, I want to mention Social Security, because you can get in trouble if you don't do it at a certain time and all this, right?
Yeah, so, very simply thinking, if you're collecting Social Security prior to hitting age 65, which you have the ability to start collecting at 62, in most cases, you're going to be automatically enrolled. So you're not going to have to do anything proactively for that. But if you are one of those folks that are not collecting Social Security and you're waiting till you hit your full retirement age of 66 in some months or 67 in certain cases, then you're going to have to proactively apply, and you're going to want to start that process usually 10 to 12 weeks before your 65th birthday.
Okay. So for those out there thinking, I'm so happy for everyone who's so wonderfully and diligently planned, and they have their lake house and they're visiting their grandchildren. Well, I'm not in that position. And I know a lot of people who feel like that right now. Like, hello, we don't have the pensions we thought we were going to have. I've worked for 40 years. I still can't afford to do anything. What are they supposed to do, Lawrence?
Yeah, so this is a unique, group of folks, because these are the folks that typically their parents and their grandparents were covered by traditional pension plans. So they worked for, 30, 40 years, and then they had a income stream for the rest of their life. And most of these folks who are turning 65 probably saw a little bit of both. Maybe started out with a traditional pension, and then it shifted over to being their own responsibility. So really, planning is personal, and you have to look at your own financial situation. And if you don't have the wherewithal to retire, you have to look at what your options are. So, we're seeing people work longer and later in life, really for two reasons. One, we're seeing a group that there's a financial motivation that they have to work continuously for income, and they haven't saved enough. And then we also see a large group of people that have saved, but they haven't prepared themselves mentally and socially for that retirement period.
So since we only have 15 seconds left, give me a very raw number, because most of us probably cannot afford the consultation fee. What is the raw number or percentage we need to have in the bank or in investments to comfortably retire?
You really can't say. That's really, really personal, because if you're a family that your expenses are $50,000 a year, the amount of money you're going to need is much different than somebody whose expenses might be $100,000 a year. So it's a very expensive proposition. You have to look at it. There are plenty of free calculators online that can help you determine what that number may be for you without that consultation.
Lawrence Brung, thank you very much. Appreciate that.